Hello, and thank you for joining us today for our Identifying and Treating Atrial Fibrillation. My name is Megan Saman, and I am the Regional Vice President of Marketing and Business Development at McLaren Bay Region. Today, we are very excited to have Dr. Abdul-Malek joining us today, a cardiologist from McLaren Bay Heart and Vascular. During today's broadcast, as questions come up, please feel free to comment in the chat box, and we will be addressing those in the Q&A at the end of our session. So without further ado, I would like to introduce you to one of McLaren Bay Region's newest cardiologists, Dr. Abdul-Malek.
Thank you, Megan. Today we'll be speaking about identifying and treating atrial fibrillation. What is atrial fibrillation? It is the most common abnormal heart rhythm. It is a fast, complex, and chaotic rhythm of the upper chambers. The upper chambers beat at approximately 350 to 600 beats per minute. The upper chambers of the heart are not contracting normally, and the lower chambers of the heart can also beat in a very fast heartbeat. How is atrial fibrillation diagnosed? Well, there are multiple tests that we can perform. Blood tests are important to rule out thyroid disease. We would do regular blood tests as well. An EKG diagnoses atrial fibrillation. Sometimes atrial fibrillation can occur in a patient, and the patient may spontaneously convert into a normal rhythm, and that may not be detected immediately. And so there are Holter monitors, 24, 48-hour monitors, or event monitors, about 30-day monitor to look for atrial fibrillation. Sometimes even these monitors may not show the abnormal heart rhythm, and so a loop recorder, which can be implanted under the skin for about 3 years to look for atrial fibrillation. Symptoms of atrial fibrillation can include general fatigue, rapid and irregular heartbeat. You can feel a fluttering or a thumping sensation in the chest, dizziness, shortness of breath and anxiety, weakness. People can faint, become confused, fatigue when exercising, as well as sweating or chest pain or pressure. Why is atrial fibrillation so dangerous? Well, the upper chambers of the heart are not contracting normally, and so the blood can pool into the upper chamber of the heart, usually in the left atrium, and causes a thrombus, which is a blood clot. And that blood clot, we are very concerned that that blood clot may dislodge. And if that happens, it can cause a stroke, or it can go into other parts of the body. There are 700,000 strokes each year in the United States, and about 15% of them occur in people with atrial fibrillation. The stroke can be a mini stroke, or it can be a disabling stroke. If atrial fibrillation is left untreated, it can lead to congestive heart failure. So the blood backs up into the pulmonary veins, and the fluid in the lungs can cause fatigue and shortness of breath. Especially, also people can start having shortness of breath when they are laying flat. Atrial fibrillation can lead to additional heart problems. Basically, the electrical system of the heart is not working properly. What causes atrial fibrillation? There are cardiac causes such as pre-existing heart disease, valvular heart disease, hypertension, which is high blood pressure, coronary artery disease. Congestive heart failure can cause atrial fibrillation, and atrial fibrillation can also place a patient into congestive heart failure, be the cause of congestive heart failure. Diabetes and post-cardiac surgery, sometimes after post-cardiac surgery such as open heart surgery, bypass surgery, we can see patients go into atrial fibrillation. The non-cardiac causes include stress, emotional pain, fatigue. Drugs can cause atrial fibrillation. Significant caffeine use may be associated with atrial fibrillation. Alcohol can cause atrial fibrillation, and some medications as well can cause atrial fibrillation. Hyperthyroidism, which is an overactive thyroid, and severe infections can also be associated with atrial fibrillation, as well as sleep apnea. And sometimes AFib can be idiopathic, which means that there's no known cause. Treatment options. Well, there are antiarrhythmic medications, multiple antiarrhythmic medications that we can use to try to maintain a patient in their normal heart rhythm. Blood thinners, Coumadin, which is known as warfarin, is a blood thinner that we have to use in some patients, such as patients that have a history of mechanical heart valve. They have to be on that medication. I have many patients on other blood thinners. There are different blood thinners that we can choose, including Eliquis, Xarelto, Pradaxa, Savesa, some of the other blood thinners. Device implants, catheter or surgical ablation can also be used to correct atrial fibrillation, and lifestyle changes, of course. So limiting the alcohol intake and abstaining from alcohol, especially if the patient has atrial fibrillation, because alcohol can be associated. Quitting smoking. Treating sleep apnea is very important. So people that have sleep apnea, that can be associated with atrial fibrillation, and we have to be aggressive in identifying these patients and treating them. Weight loss is really the most important thing with sleep apnea, but the patients will also need a possible sleep study and CPAP in certain cases if they have sleep apnea. Avoid triggering physical activities. So new advancements are there as well. I talk with some of my patients about the Watchman device. So this is a device, I like to explain it to patients in a way where makes it easy to understand that in the heart, in the left atrium, which is the top portion, the top upper chamber of the heart, there is an area called the left atrial appendage. And the left atrial appendage is an area where the significant amount of blood clots love to hide in that area. And so what the Watchman device is it's basically like an umbrella to cover that area. And so if a blood clot occurs in the left atrial appendage, the idea is that it cannot escape that area and it cannot go to the brain and cause a stroke. It's important to keep in mind that patients who are candidates for the Watchman device have to be able to tolerate blood thinners for a short period of time, about 6 weeks, and then we take a look at the area through a special ultrasound called a transesophageal echocardiogram, or TEE, to take a look at the area and make sure that there's no that the Watchman device looks good, and then they may be taken off of the blood thinner by their doctor, by their cardiologist. A person's heart tissue will grow over the implant in time, and at that time they may be taken off of the blood thinner. Thank you. If you have any questions, we will go into questions. Please, I'd like to direct your attention to meeting your heart experts. Over 100,000 cardiac catheterization procedures are performed in McLaren Bay region. It's world-class structural heart program and providing the latest in minimally invasive procedures. And we have the region's leading open heart program. Any questions?
Oh, thank you so much, Dr. Abdul-Malek. That was some wonderful information and very useful for, I'm sure, everyone in our community. So we will be taking questions from the audience. And the first one is from Brandon Smith. And it says, is it true that caffeine should be avoided with AFib?
So I generally recommend that, yes, you should avoid caffeine. Caffeine can be associated, significant amount of caffeine can be associated with atrial fibrillation. And some people are able to tolerate small amounts of caffeine. So if somebody cannot go through their day without a cup of coffee. I mean, 1 cup of coffee may be okay, but for those who are drinking 5 and 6 cups of coffee a day, I definitely tell them to cut down as much as they can on the caffeine intake, because it can be associated. Yes.
Great, thank you. Our next one is from Laura Love, and she asks, how long do AFib episodes last?
So that's a great question. I mean, atrial fibrillation, there's no specific time that I can give to say how long atrial fibrillation lasts, but usually, and per guidelines, we have, if we know that the atrial fibrillation has been there more than 48 hours, then we have to recommend blood thinners. The palpitations with atrial, if someone goes into atrial fibrillation, it's not usually a palpitation that comes on for a second and goes away. It's sometimes there, it can be, most of the patients would say that it can stay for about 15 or 30 minutes. And some patients will have palpitations that go on until they come to the emergency department, and we have to give them some IV medications if their blood pressure allows, to get their heart rate under control, and that's when their palpitations resolve.
Great, thank you. Our next question is from Sarah Berry, and she asks, how do you differentiate AFib from symptoms of anxiety, which often mimic each other?
Oh, thank you, Ms. Berry, very much for asking that question. That's a very important question. So, anxiety, some patients have anxiety, and the palpitations from anxiety, they feel that something is going on and something is wrong. So people with atrial fibrillation may also have different types of symptoms with their palpitations. Some of them may have lightheadedness or dizziness. Some of them may be short of breath, but some of them may only have palpitations. So if these palpitations go on for a long period of time, more than 5 to 10 minutes, you may need to get an EKG with your doctor, or if the symptoms don't go away, then you may need to go to the ER and get an EKG to see if this is atrial fibrillation or not. Now, for young people who have Apple Watches and they're able to monitor their rhythm, usually the atrial fibrillation, the heart rate is not in the 90s or 100s in the most part. It can be very fast, in the 160s, 170s. So to go back to Ms. Berry's important question, is that, with atrial fibrillation, if you have an Apple Watch, and it can tell you sometimes that this may be concerning for atrial fibrillation, and you can show your doctor. And then depending on your risk, then your doctor may also recommend blood thinners as well. If the EKG is normal and they do a monitor, a 24 or 48-hour monitor, or your doctor may choose to monitor you for longer, and it's normal rhythm and no atrial fibrillation, then it may be more linked to possible anxiety or other causes.
Great, that's wonderful. Thank you so much. The next one is from Tim, and he asks, I had a catheter ablation to fix AFib when I was a teenager. I thought I was done with AFib forever. 20 years later, I have started to have flutters and irregular heartbeats from time to time. How likely is it that my AFib could return?
It is possible. So if someone had an ablation procedure in the past, there is a success rate with atrial fibrillation. The first time maybe at 60%. Some people with atrial fibrillation, they have to undergo more than one ablation to try to correct atrial fibrillation. So if Tim had the ablation for a long time, and then the fluttering returned, it could possibly, you may need a monitor to place to see if you're having other episodes of atrial fibrillation. And that monitor could be different for different types of patients. So if you had catheter ablation years ago, and now you're having palpitations that come on once every 6 months, and they're scaring you to the point where you have to go to the emergency department, in that case, your cardiologist may recommend a loop recorder, which stays there for three years to see if you go back into atrial fibrillation, and you may end up needing another ablation procedure.
Great. We appreciate that feedback very much. Next up, we have Gina, who asks, if I lose weight, will AFib go away?
So good question. So weight loss is extremely important. I think all cardiologists want their patients to be very thin. The reason for that is because there's multiple reasons. One of the reasons is that by losing weight, your general health improves. But when it comes to atrial fibrillation can again be associated with obstructive sleep apnea. And that's very, very important. So the treatment for sleep apnea really is to lose weight. So if you lose enough weight where you don't have sleep apnea, then yes, the atrial fibrillation may, I can't say may go away forever, because some people may have the substrate, if you will, for atrial fibrillation. So atrial fibrillation may return. So to answer that question, weight loss definitely helps. It may not cure atrial fibrillation. So I can't tell you that you may not have atrial fibrillation in the future, but definitely it is very much recommended for people to lose weight with atrial fibrillation.
Thank you. Okay, next from Sarah, we have, thank you for all the information. If somebody's EF is decreased, can that improve over time if they get cardioverted?
Wow, Sarah must be in the medical field. So that's a very good question. So the ejection fraction is, we refer to the heart function, the way the heart squeezes, we say ejection fraction, EF. And so normal heart function, EF, is 55 to 65%. So that's a very important question that Ms. Malek brought up. And the reason for that is the EF, the heart function may decrease in patients with atrial fibrillation. And so because the heart is stressed, it's overworked. So the heart muscle is stressed and overworked, and over time it can weaken. So to answer the question, if somebody's heart function is decreased, can that improve, or can that be improved over time if they get cardioverted? Meaning that if we shock a person into a normal rhythm, can that heart function improve with time? Yes, it can improve with time. But there's also something important to remember, is that it depends on the risk that is associated. So if someone's heart function is low and they are diabetic, they are smokers, family history of heart disease, we may also need to investigate if there are blockages in their arteries that are causing the heart function to be weak, aside from just blaming it on the atrial fibrillation. So these people may be cardioverted, and over time we may recheck their ejection fraction. And if the ejection fraction continues to be lower than normal, then they may need possibly a cardiac catheterization or a coronary CTA to look at their coronary arteries and make sure there's no blockage.
Thank you for that great description.
Thank you.
Next up, we have Amy Kaler. How do you calm an AFib event?
So in an atrial fibrillation event, people that have, let me go into another thing by saying that there are some people that have something called supraventricular tachycardia, meaning that the heart rate is fast, but the rhythm is coming from the top chamber of the heart. So with these patients, we tell them, coughing, different types of maneuvers. They can bear down. Carotid massage can cause the heart rate to go down. and for the symptoms to improve. However, patients with atrial fibrillation, if this is something that occurs, usually may not occur often, your doctor may give you a pill to take when you feel the symptoms. Pill in the pocket approach, we call it. And so this is one way that you can talk with your doctor if you're having atrial fibrillation events that are spaced out and you don't want to undergo an ablation. That could be a possibility to calm down the atrial fibrillation event in that standpoint.
Thank you. And we have time for one last question this evening, and it's from Diane Morley, who asks, describe what an ablation procedure is.
Okay. So an ablation procedure is done by a cardiac electrophysiologist. I don't do the ablation procedures. I'll talk to you about it, but this is a procedure that is done by the electrophysiologist. So, for example, if somebody presents to me with palpitations and I diagnose atrial fibrillation, and then I speak with the patient and we decide to proceed with catheter ablation, then I refer the patient to the electrophysiologist who will do the ablation procedure. And basically what the ablation procedure is the electrophysiologist will get access into the vein areas in the groin area and will advance a catheter up to the areas that are producing the atrial fibrillation. So for atrial fibrillation, we will be talking about like pulmonary veins, isolating these areas and ablating. Basically, you can think of it of burning around these areas to correct the atrial fibrillation procedure.
Dr. Abdul-Malek, thank you so much for taking the time to spend with us today and educate us about the importance of AFib and the treatment options with it. We appreciate you and your time and look forward to continuing to work with you in our community.
Thank you very much.
Great. For more information and upcoming events and community screenings, please visit us online at mclaren.org/hearthealth for more opportunities to learn about what our amazing cardiology team has to offer. Thank you so much for joining us.